Welcome back to the Health Report, your go-to channel for all things health and vitality. Today we're diving into the topic that affects millions worldwide, high blood pressure. But fear not, because we're about to unveil nature's own remedy, herbs and spices. Ginger. Ginger root has shown itself to be very helpful for blood pressure in numerous studies. It can reduce both systolic and diastolic blood pressure, and daily consumption of ginger is linked to an overall lower risk of hypertension, high blood pressure. Researchers believe that the effects of ginger on blood pressure come from the fact that it acts as a natural calcium blocker and ACE inhibitor, both of which are types of blood pressure medication in conventional form. Studies indicate that a daily dose of 2 to 4 grams of ginger is most effective for lowering your risk of developing high blood pressure. Beets. Beets are not technically an herb or spice, but they do function in the same way when consumed as a powdered supplement. And they work better this way for those who don't like the taste of beets or can't eat enough to get their full health benefits. One truly incredible property of beets is their ability to help lower blood pressure. Most researchers believe this is due to nitrates present in beets that are converted to nitric oxide in your body. Nitric oxide has vasodilatory effects, meaning it helps your blood vessels to widen or open, which causes blood pressure to drop. Beetroot supplementation seems to have the biggest impact on systolic blood pressure, which is important because it's considered to be more of a risk factor for heart disease when raised than diastolic blood pressure. Garlic. Garlic is another superstar when it comes to blood pressure. The powerful sulfur compounds present in the garlic cloves, allicin and diol sulfide, have positive effects on blood flow and may help to relax blood vessels, which both contribute to lower blood pressure. In fact, one research review that looked at multiple studies on garlic and blood pressure concluded that garlic supplements can be as effective at reducing blood pressure as first-line standard antihypertensive medication, which is quite a statement. Most studies use aged garlic extract rather than raw garlic. Doses between 300 and 1500 milligrams have all been found effective. Cinnamon. The same spicy compounds in cinnamon that make it beneficial for cholesterol and triglycerides can also help lower your blood pressure. As one research review of 9 separate studies determined, cinnamon can reduce both systolic and diastolic blood pressure by an average amount of 6.2 millimeters Hg and 3.9 millimeters Hd, respectively. Other studies have confirmed these results and indicate that cinnamon can be especially helpful for those with diabetes or who have high blood pressure already. Effective doses of cinnamon range from 500 milligrams to 200 grams in the studies, but the best results were seen when cinnamon was taken daily for at least 12 weeks. Cardamom. Cardamom is a highly aromatic spice that comes from a plant related to both ginger and turmeric. Once the third most expensive spice in the world after vanilla and saffron, cardamom is full of antioxidants and potent compounds that benefit blood pressure. In one small study, adults with mild hypertension took cardamom powder daily for 3 months. At the end of this period, participants experienced a decrease in systolic, diastolic, and mean blood pressure. They even reported feeling better too. The amount used in the study was 3 grams of cardamom divided into 2 daily doses and taken for 12 weeks. Parsley. Parsley is a bright and fresh herb packed full of nutrients and beneficial plant compounds. As far as blood pressure is concerned, parsley contains 2 specific groups of compounds that can help: carotenoid antioxidants and nitrates. Several studies have shown that carotenoid antioxidants can significantly reduce blood pressure and help with other risk factors for heart disease like inflammation and high LDL cholesterol. Nitrates, also found in beets, have a vasodilatory effect when they are converted into nitric oxide within your body, which means that they lower blood pressure by causing blood vessels to widen or open. Researchers have also found that parsley can act like a calcium channel blocker, which may give it even more effectiveness for lowering blood pressure. There's no recommended dose of parsley for blood pressure, but this is an herb better eaten fresh than dried.